Okay. So a little bit slower with my technology today here. How are we doing, Steve? Do you have who you need out there?
Yes, Mr. Chairman, staff is all here. And it looks like we have all of, let's see, I don't see Supervisor Vasquez yet.
Okay. There we go.
Let me see if he's on the attendee side.
Yeah, I'm a little slower with my
Uh,
technology. There's that. Bring that over there.
There he is.
Is he?
Okay,
There we go. Okay. All right. So, well, I want to welcome everybody. Today's Friday, December 10th. And so we're posted for a special meeting to begin at 1 o'clock today. And the first item of business is, I'll go ahead and call the meeting to order. Who is sounding like a mouse out there? Let's just make sure we have our technology put together here.
let's see, everybody is muted except me and you. So it's
Okay. Okay. Well, let me go through, have the board members say hello, and then we'll get rolling here. So roll through District 1, Supervisor Enforcement. Patrice?
Yes, good afternoon and happy Friday to all, and glad to see we got ourselves some rain and then some snow, much needed in Flagstaff. So good afternoon all, looking forward to an expedited but very important afternoon meeting.
Right. And then District 2, Supervisor Vasquez. Arpa? You're muted or something. Yeah, you're the mouse out there. Okay. You might need to.
So Supervisor, you'll have to leave and come back again.
Yeah.
Thank you.
All right. There we go. I knew there was one out there somewhere. So next we go to District 4, Supervisor Piquet. Judy? You're on mute. You're still on mute. Yep.
It must be a Friday.
It must be. Yeah, my technology was slow, but that's why I was coming in a little late here. You're still on mute, Judy. Can you hear me? Could you nod your head if you hear me?
Okay. Good afternoon.
Oh, there you are.
Everyone.
Yeah, there we go.
I think I just want to thank everyone for being on this meeting, my colleagues and others from the community and staff. We have a very important meeting today to take care of an issue which, that we need that needs to be dealt with. And so I just want to say happy Friday and look forward to this meeting.
All right. And we have our Vice Chair, Lena Fallon. Lena?
Good afternoon. It's really good to be here with you all again. You're all starting to look familiar. And I am very happy with some moisture that has come in. But I wanted to show my screen because it is just not enough. We need more. So we all have to pray that we have more moisture to rejuvenate our souls and Mother Earth and help all the wildlife and all the creatures and beautiful birds out there. So thank you.
All right. And then we'll go back to District 2, Supervisor Geronimo Vasquez.
Good afternoon, everyone. Can you hear me now? Or am I
Yes.
still mouse? Okay, good.
You're good.
All right. Well, thank you, everyone. Really encouraged that we're having this meeting. I know it's an extra meeting, but this is important work. And in order to have the time to process through what we need to do, we need these extra sessions. So I really hope the community's out there listening so they understand why we're making the decisions we're making as we go through this process. So thank you for participating, and thank you everybody for being part of this collective effort.
All right. So we have was that Supervisor Vice Chair? Did you have a comment?
No, just thank you for taking your Friday and afternoon and joining us and going through this process with us. Thank you.
All right. Well, as noted, we have a potentially busy schedule here, a very important phase of where we need to go. We've been working our way through the ARPA funds. But the next piece of business that we have is the Pledge of Allegiance to the flag. So if you could please rise and join me if you have the ability to do so. And if you don't have a flag before you, face to the east. And I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, and then we have the call to the public. This is a courtesy the board offers the public to bring an item to our attention that is not on the agenda. And then Lindsay Daly, our clerk of the board, would explain the process to be used. Lindsay, out there.
Thank you, Chair Ryan. If you would like to make a comment at this time, you can hit the raise hand icon at the bottom of your screen that looks like a hand. And then that will notify us that you want to provide a comment.
Right. I'm not seeing any on my side. Let's see.
No, there's no hands raised, and we do not have any emails in the board comment email box.
Okay.
Mr. Chair.
Yes, Steve.
And just to reiterate, to repeat what you said, that the public comment would be for items that are not on the agenda. I know we have several community stakeholders here today in attendance, but again, this is a board study session. It's the board's call. If at some point you wish to receive input, but again, it's not structured for that. There will be other input opportunities, but at this point in time, I just want to make sure that clarification, because we do have a number of stakeholders, but of course, it's the board's call on how you wish to handle that today.
And probably to follow up on that, and it'll be a broader piece of the presentation, but I know there are stakeholders that have specific projects identified. Right now we're working our way through process and developing process with the board. And so that is an element of that. There will, as we progress through developing our process, there will be future opportunities for more specific use of the process for projects. Okay, so I'm not seeing or hearing anybody lined up to comment. We'll go ahead and close this call to the public. And now we're going into the discussion and possible action associated with the consideration and possible direction and/or action on the American Rescue Plan Act, the fiscal year 22 budget related to the county programs, community funding, and business supports. And so Steve and staff have been working on this quite a bit. We've gradually progressed through various phases, and we're down to one of our final phases of at least direction of the ARPA, or it's not ARPA plan. So I'll turn this over to County Manager to begin the process and where we left off at. Steve? Okay.
Mr. Chair, members of the board, as we get down the items to discuss, I see Vice Chair Fowler came on. Did you want to recognize? You good? Okay. So as we were all with each other on Tuesday to discuss the mental health portion of the recommendations, we did want to have the opportunity to close up the discussion on the mental health component. And so a couple things, Mr. Chair, if you would like to ask for board member feedback on that before we proceed onward. But one of the important components that actually is important as we begin the discussion on the outside funding is related to the availability of funds. One of the discussions on Tuesday was of the $5 million that is remaining for community partnerships, that 2 million of that was recommended to be held for mental health programming in the community. Since the discussion, staff have met, and our recommendation at this point in time is to proceed with the full $5 million in the community funding, knowing that we will have the opportunity through the community grant process to receive proposals that may have an intersection or nexus with mental behavioral health. And then the other important part of that is that I just forgot my train of thought. But again, it'll be part of that discussion with that community pot. So again, that is one of the notable changes that has come from Tuesday's meeting to today. And I see Supervisor Vasquez has his hand up, Mr. Chair. And I'll stop and receive comment from you, Mr. Chair of the board.
Sure. So Veronica.
Yes, thank you. Thank you, Steve. My question is just clarification on what you're saying right now, because I don't think I understood it correctly. The 2 million that you were saying that the staff was originally focused for mental health component, was that 2 million that would have been taken away from the community partnership money, the 5 million? Or was that something different? Because I didn't understand that.
Mr. Chair, Supervisor Vasquez, we were not taking away. That was originally programmed to have 3 million, 5 million total. 2 million of that would have been the mental health. The other part, though, and I remember what it was, is that when we get to the categories of community funding, we have added mental behavioral health as a category along with the other categories that we talked about earlier. And we'll get to that slide in a minute. But again,
yeah, no, thank you. I appreciate that. I just wasn't sure if where we were talking about those 2 million and how that played into the full 5 million community partnership piece. So in essence, just for my understanding, we have several buckets, 6 different areas that we're looking at. Mental health is one of those, and the original staff recommendation was 2 million towards that bucket per se of the community $5 million.
Right.
Okay, thank you.
But Mr. Chair, very quickly, if I could, what staff would like, though, is the feedback on the mental health component, so we can, if you will, wrap that discussion up before we move on to the community partnership funding. So it would be informative and insightful for the staff to listen and to hear the impressions of the board members related to the mental health discussion from Tuesday. Thank you.
Okay, Mr. Chair.
Go ahead, Vice Chair. And then I have Supervisor Horstman just after you. Go ahead.
Okay, thank you. Thanks, Steve. Yeah, I'm trying to understand the presentation that was provided by the internal judicial behavioral health and the other components of mental health, the school district. That is still the same, right? It's still those dollars, for the Superior Court, the new district or new division. That is still the same. When you mixed it up, I ran off the track too.
No,
so,
no.
Okay, that's still the same. And today you just want that discussion, a wrap-up discussion, and then we're going to move on to the community the process for the community. Okay, gotcha.
Yeah, and
following along, and then I ran off the track somewhere.
Sorry.
Yeah, and a piece of that is because the funding is outside the mental health discussions within the county itself, the clinical, which are provided by outside providers that we don't have the expertise. That's where the recommendation of the 2 million was associated with this 5 million total. So Supervisor Horstman.
Yeah, thank you. And thank you, Chair, and also County Manager. And I'm really, I agree with the staff's recommendation to have the 5 million for community partnership and to allow, obviously, behavioral and mental health, such an important concern for us here in Coconino County and for our residents, to have that as part of the bucket for that $5 million. So I think that was a good recommendation from staff. I look forward to further discussions when we get to that bucket. To answer more specifically your request, Chair, and given the meeting we had and in hopes of trying to wrap it up, I certainly believe that behavioral and mental health has got to be one of the very top priorities of Coconino County. I know you probably saw that the chief surgeon of the United States government came out with a report talking about the effect of mental health, especially on our youth, given COVID, and that this is a major mental health crisis here in our country. I think that the fact that the county is basically upping its game in behavioral and mental health for the residents of our community is really important. And I really want to commend the county for doing this. The county health department adding a division for community mental health, and I know they're calling it resiliency, and I'm forgetting the term. I apologize, but in essence, it's a behavioral and mental health division or component for our county health department, and I'm very pleased to see that. Obviously, as I said before, and I think my colleagues on the board agree, the intent is certainly there. Of us to provide more services and to provide better mental and youth health or mental health and youth programs for our community. The need is more than there. We have seen it for years. The Arpa funding allows us an opportunity to expand these services and then in some cases provide them for the first time. And I do believe we have the professionals who have the knowledge, who intend and will follow the best practices and create a holistic system with overlap and coordination for behavioral and mental health within Coconino County. So I'm very, very pleased with that. To make it very specific and clear, I'm in agreement with the $606 for building resilient youth educators, school communities for the superintendent of schools. I would also be in favor of the $136,640 for the non-detention alternative NFHC youth shelter or Halo house. I would also be in favor of the $2 million as set forth for the behavioral health pilot program, which is really a two-part. Number one, and probably most specifically, would be to create that division within HHS, which I really believe is long overdue, and I'm very, very excited about that program. And then secondarily to that is that pilot program located within the Page community as a pilot program to look at small rural communities. And I do think that those are the three large ones within mental health that I am in favor of. I'm also in agreement of the new Superior Court division, although I don't know if you're asking about that yet. If you are, Mr. Chair, I'll continue. Otherwise, I'll take the talk about the three behavioral and mental health programs.
So in terms of those were the pieces that we had gone through this past week. That's what we would be seeing on the next discussion associated with them. We're swinging into the outside agency where the support programming would be. That's where and Steve, clarify, could you please?
Then I'll stop and make it very clear that the three mental health, behavioral health programs as recommended by the county to be overseen, quite frankly, by the county or county departments, I am definitely in favor of, and I'm looking forward for the 5 million community partnership discussion, of which one of the buckets will be behavioral and mental health. So thank you.
I'd like to make a comment.
Go ahead, Judy.
Supervisor McGee. I think there's, thank you. I think there's 3 areas that I would like to make sure that while we're talking through this process, I think there's 3 real areas other than the ones that has been mentioned by my colleagues already, is the prevention component of it, the prevention component, and that I think was mentioned that it should serve all county residents, rural, wherever it may be. And then the last is what's important to me is the compliance of the funding requirements. We have to make sure that that's there at the end. So those are the 3 areas. I did want to mention others that have already talked about other areas, but I'll just leave it at that. Thank you.
Okay. Let's see. Do we have, go ahead, Verona. Supervisor Basket. I'm trying to remember, we didn't do the numerical, so I'm confused.
No, I'm sorry. I did want to comment on the mental health piece. I was earlier just asking for clarification on what we were talking about in terms of what the buckets were. But I'm in agreement with my colleagues. I definitely support the recommendations of the staff for all the different mental health components. I like the way that they all intersect. I did have some input since or questions by constituents since our Tuesday meeting. And the question was, where does veteran service fit in that? Veteran services fit in the whole realm of things. And we don't have to have that discussion. I just wanted to put that out there. But the other piece, and this is my piece that's the concern, is I support all these programs and I really want to see them happen. Yet when we were presented, there was no methodology presented of how the needs of the community were going to be addressed. And so I'm comfortable with these programs. I just want to ask that we adopt a methodology. I believe the RARE methodology is the proper one for this process. However, I'm open to other methodologies, but I do want to see a methodology that's used to find out what people need right now. Because as I was going through and listening to these presentations and listening to the different programs, I saw a lot of the forest, but I didn't see the trees. And I know we're being recommended to avoid that right now, look big picture, and that's fine. What I'm afraid of is we approve the funding and then the details get lost, and then we're not as focused on the needs that we need to be, and that we shoot from the hip without knowing exactly what each community and each program needs or each constituency needs. And so that's why I'm really advocating the RARE assessment. It's very fast. It can be done between 1 to 3 months. But I really want to see, once we approve these programs, that we go through that assessment so we know on the ground right now what each community or what each program or what area mental health are the needs now, because they've changed. You know, if some of these organizations are coming to us with, you know, where mental health was at the beginning of the pandemic, that's changed over 1.5 years. You know, I just spent the morning at Killip Elementary School listening to staff members talking about how COVID's interrupting the learning process, how quarantine is interrupting the learning process. I didn't know that. And I feel like that's kind of where we're at right now, is we're so looking at the forest, we're missing the details of what the trees need. And so I just want to advocate for that methodology. And but beyond that, everything else I'm in support of, and like the restructuring, the addition of the mental health department. I agree that that's something that the county does need to do, and I'm supportive of it. So thank you.
Okay. Heard from everybody, I guess, except for me. You know, my comments are, you know, I understand the need for mental health, the clinical side. If it's 2 million, maybe I want to see where our discussion goes later on in terms of we have multiple categories out there. See how the board feels about that, but that's the current recommendation with staff associated with the programs out there. You know, we're trying to put the full program together, so I understand that recommendation. I came in, you know, after hearing the recommendations throughout our whole process with that understanding, but it's hard. Mental health is complicated. There are multiple elements, whether within the system or outside by outside agencies associated with that. So with that,
Mr. Chair,
Yeah, go.
Vice Chair Fowler wants to make some comments.
oh, I'm sorry. Okay. Go ahead, Lena. I gotta pull up my screen. Oh, I had the wrong side. I gotta look at the panelists. There you go. So, Vice Chair, Lena Fowler. Lena.
Thank you. Yes, I'm still here. So it is, it's a process. It sounds like it's going to be the way that it is laid out. You know, the prevention side is very focused on the youth. In the school systems, which I know that the students and the families really need that support. The juvenile justice, the HALO program, I didn't know there was such a program. And with the domestic violence as high as it is that we're told and in our region and elsewhere, I can understand that. The only thing is it's removing, it's going to one place. I like to see if we can identify a site that is outside of Flagstaff that could be used as well, rather than just one location. So the location that is identified is Northland. And I'm just trying to see if there might be a way of identifying another place closer to home. You know, even when you remove children, they really want to be close to their parents, to their relatives. For that reason, that's why I'm thinking that if at all possible, if that could be done, I think that would be helpful for these children and their families. That way there's a little more contact. The schools, there are various schools. It sounds like it's not just for the public school. I'd like to see how they are going to reach out to the other schools, because it was asked if it's only for the public schools. But I know we have even within the oversight of the superintendent is the charter schools and these other schools. So I'm wondering if that will be, they'll be able to also include them. And if it's other schools, because the question was asked about a grant school on Navajo Nation. On Navajo Nation, there are different types of schools. And so just want to find out more about that. The behavioral health, the 2 million, there's the recovery resiliency. I'd like to see if it's a special division that is being established. I want to see if that division will be able to at least have not a clearinghouse or oversight. I know that the courts have their own, everybody is they're all working together and integrated, but at the same time though, if there's a division, it'd be good to have that as a report site. So our organization isn't structured that way. I know that the county manager is the place and the deputy manager, but I wanted to see what the role of the division will be for all the other programs. So the youth program, those are all in that. And so I just want to thank all the staff for answering the questions, just trying to understand, and also providing information to the public, because that is what our job is. Also for us as board members to be able to be informed so that we can make a decision that we're comfortable with. But at the same time, we ask questions also that we already know the answer to on behalf of the public, so that the public knows what we are, what we're working on, and how they maybe impact, or they can get involved, like the nonprofits and other partners that are listening in right now. They're part of this plan as well. And in each of these plans, nonprofits are mentioned. Now, I will say that I am still, it is a big picture, but when it came down to partnership, that's where I kind of get concerned that this is such a short time span, and yet we still have to identify our partners and how it's going to be done. If there is a methodology, if there is a way to be able to identify what the needs are at the local level and be able to identify partners right away, that would be very helpful. So maybe we can look at what Supervisor Vasquez is asking for and see what that is. And maybe the staff has another way of approaching that. So I am concerned about that, but that's not a reason to stop this program. But that is something to look at. For the courts, I'm still concerned about the courts, the new division. The new division is a huge step, and it's going to be hard, very difficult to all of a sudden stop within so many years when these dollars are done. There's got to be an exit plan on all of these programs, because the county, it's not within our general funds to be able to fund these. And if there's general funds that these programs are looking at, we're going to have to start having those discussions now. And how is that going to happen? And that's where, our own accountability internally as well as externally comes in. And these are federal dollars that are one-time funding, which we've been talking about. And we want to make sure that they are impactful, and it does lay the stage for a successful recovery of families, individuals, and our county. That's what we're looking at. That is our focus, is just the program and how it is going to impact. We're not looking at individuals or anything. It is what is going to make an impact and how is it going to be sustainable. That holds true for the outside agencies that we're going to be having meetings about here soon. Mental health court, I guess I should finish with the new division. The new division has an impact on all of the departments that are working with the division. I asked about if they have enough staff to be able to carry on with another division. And everyone said you can. I had opened the door, kind of thought I was opening the door to maybe do a study to see how we might be able to implement maybe a comprehensive study for the competency and restoration service that will save us money in the future, our funds. But it sounds like, to me, it sounded like that was not needed. I was thinking about a comprehensive study that includes Navajo Nation, includes other partners, rather than just having our programs do that service. So how, if that was to be picked up, how would it be picked up? And it sounds like maybe, no, this is just me listening in right now from the presentation, is that it's the health department and the courts that are working on it, and maybe probably some other county attorneys and others, and maybe a few outside agency. But I would think if it was going to be a very effective, comprehensive and sustainable program, you want to do a study and see where all the partners are and what could be done. Knowing that many of the people that we're talking about are from the Native American community, I thought that there might be a comprehensive study that would be done, and maybe there's some partners that we can bring together. So if I still would like to see that, if that is possible, but if it's not possible, then it's not. That's fine. That was just an idea, just listening to everyone. The mental health court. I wonder how the mental health court is very active and really appreciated. And all the other specialty courts, not just mental health court. I think mental health lies within the Veterans Court. I know that personally, and other family court and elsewhere. Mental health is through all of our specialty courts. I wonder how these dollars might be able to help the justice courts that are outside of Flagstaff and Williams, Fredonia, Page, and all of those. I'm sure it's already in there, but I just want to bring it up, and how I know that mental health is within all these other courts, and so I'm sure somehow the plan is in there somewhere, because we're looking at a bigger picture. So I think that's how I'm going to talk about that one. And the reason I'm concerned about the staff with the new justice, the new court, and the Superior Court, what is being proposed is because our staff are already they're already doing more and has done more than they've ever done, and more than what they're expected. They all should receive awards, every single one of our staff. Through this pandemic, it's been very emotional working with communities that are in need, and also just dealing with yourself and your own family. And that's where I get very concerned about this. Something else that they're already stretched. They don't have enough staff, and yet now here we are delivering another service to them. So in every one of these proposed programs, that's what I'm looking at, is how are the staff going to be able to handle this? Are there additional staff that need to be brought on? Maybe it's embedded in these proposals. So I would say to management to really sit down with your staff and see if this is something that is that's going to be, they'll be able to carry without having too much stress on them. So that would be something I think. The other thing that I thought was interesting too, while talking about mental health, is that there wasn't a program that was presented for our own staff. We know that we have no programs that are set up, but there was not an additional program that was proposed to help them to be able to deal with what their own personal situations. We know that the health department, all of the departments have been under a lot of stress, and yet here's new projects that are coming on. I just hope that our staff take the time during these holidays to take time off, turn their cell phones off and their computers off, and just be and be with their family and not have to worry about work. And that's what we all need. And so that's why I say that I actually thought there would be a program for our own employees. So, so I would say that from all of this, with all the questions I've had and everything, I am supportive. I am supportive of these. I still have questions, but with all that, I'm just gonna go along and but I like to see what I brought up to be looked into. So that would be how I look at these programs right now.
So, and that would be helpful in terms of as they develop what they're doing, how they fit in, and they can come back with that. So added to a little bit of the confusion here. These are some of the summary pieces. When Steve was saying summary, the summary component is actually the last piece is there was a recommendation of the $2 million, which would be referrals, which would be outside agencies. So that is our primary focus for today, is that in outside agencies and this last 5 million. We will have this other piece be brought back, but the conversation I think is very helpful for staff as they bring back the recommendations, and not only that for us. Because we can't cover all questions during the meetings, it provides us an opportunity to continue to mine down with staff and find out cause and effect. How are you developing that program, or where is this? What is did you consider? So very helpful in that way.
Mr. Chair?
Yeah, go ahead.
Internally with the programs that were presented, it's over $5 million. I'm just wondering if is that the amount that is needed just internally? So that'd be just my question.
Mr. Chair.
Yeah, go ahead, Steve.
Well, and to all the supervisors, your comments and your questions, I, along with all the other staff, have been furiously writing down all your notes and your questions. And I would like to come back to the board to respond and provide information regarding some of the questions and the statements that have been made. So rest assured, we'll be, as we move ahead, we'll also be closing the gap on some of the questions that you've raised related to all the things you've raised. But it doesn't end here. I mean, throughout the process, continually asking questions, but also we will be also adding to our standing agenda is programmatic reports back to the boards on the implementation as we move to the point of determining and finalizing process, and we begin executing on some of the plans and the implementation occurs. We will then be reporting back to the board on a regular basis what the implementation process is looked at. Some of the things that we may have envisioned that may be in terms of challenging or maybe also opportunities. But again, we will definitely be keeping this as a regular item on the agenda so that you continue to be in the loop, but also asking questions and hearing on progress that's being made. So we'll do that most certainly. Thank you, Mr. Chair.
Okay. So actually at this point, so we can pursue the question, is 2 million enough or not, or too much? But the second phase of this is taking a look at the process that's being developed associated with the discussion overview, as we deal with the outside agencies, and it includes our own internal process, the regulatory environment, board direction associated with some of the targeted areas. Let's evaluate that, see if we can refine that for the sake of staff as they develop the process, and looking at the rubric, the evaluation process, and then how to implement. So there are primary questions that we'll be wandering through today. And so I think it would be good that we start to step into the discussion of the regulatory environment. And Steve, I turn it back over to you for that.
Thank you, Mr. Chair. We'll go ahead and walk through the PowerPoint presentation we sent out earlier. We've made some changes, initial changes, some changes to the original version. One of them was, though, that we've changed the amount available from that has been stated several times today to fold into the community funding pool of funds, the $2 million that were originally set aside for mental health. And so let's see, Erica, are you going to walk us through the slide? Let me pull up the slide, please. And then, so the discussion today, and between myself and Siri, we'll be walking through some of a few of the slides. There are not that many slides, but again, we're focusing in on the community partnership piece of it, which is allowable. So you can see here the regulatory environment, board direction, and again, these are discussions that will begin today, not conclude today. And so again, I think it's important, as Supervisor Vasquez and others have indicated, to look at identifying what are some of the foundational pieces to it, but at the same time, while there is a sense of urgency to be implementing and investing these dollars throughout the community, there's also the necessity to look at the needs and how the methodology has been mentioned, so that we can be better assured that we're addressing the most urgent needs. So funding priority, target areas, target allocations, evaluation rubric, how are we going to rank, if you will, or how would the proposals be ranked? And then looking at options for project solicitation and program administration. In other words, the process that we're proposing in terms of the community grants process, is that an internal process, or will we be looking at a community organization in the community that would be best suited to administer and to implement a grant program of this type? Okay, the next slide. Let's see. So the county receiving funds, you can see here the local recovery dollars under the American Rescue Plan. In May of this year, the Treasury issued an interim final rule to implement the local fiscal recovery fund component of the program. And this document focuses on the allowable uses of funds. And that's an important piece, of course, throughout the entire process that we've had. We've been talking about Arpa, American Rescue Plan, for the last 5 months. And we always refer to Treasury provides the guidance in terms of how the program is administered at the federal level. And then as we proceed through the process, there are steps that we need to ensure that we can do in terms of being a county within the state of Arizona. And so we're taking federal guidance, and then we're folding that into what is our county statutory ability to enact on some of these programs. And so you see that the Treasury provides that broad guidance on the allowable uses of funds. June of this year, the coronavirus state and local recovery fiscal fund guidance on recipient guidance, big title there. That was also released, and this document is in its 4th revision as of November of 2021. And so again, that continues to be refined based on input from Treasury, which put out the final document. And this summarizes compliance responsibilities, including allowable activities, allowable costs and cost principles, procurement, suspension, debarment, reporting, and all the sub-recipient monitoring that goes into it, and then creates the award terms and conditions. And this is an important part because when we go through the process of identifying community partners to implement on some of the programs, they then become a subaward or subaward recipient and are held to the reporting that we would be then rolling up and providing to Treasury. So while we do definitely benefit, the community benefits from the federal funding that comes down, there are some fairly important and critical reporting requirements that go with this. Further guidance is expected. Department of Treasury continues to issue rulings based on some of the inputs from states and local governments throughout the United States. So it continues to add to the final rule. And then finally, funds will be audited for compliance. And you can see here with federal uniform guidance and requirements specific to the state and a local fiscal recovery fund program. And then these funds are considered a type A program for single audit purposes. And so every year the county, as a recipient of federal funding, goes through a programmatic audit of those federal funds. And now that we are receiving even more federal funds, that audit is going to be, as it's always been important, will encompass additional areas to cover because of the number of programs, not only internally, but externally, that are being administered through the funds. And I see Vice Chair Fowler popped up. Maybe she may have a question.
I'm trying to find my mute. Nina, did you have a question? I was hoping maybe we could roll through this and then have questions afterwards. I didn't say that ahead of time, but you know, if you need clarity now, we can go for it.
I can wait.
Okay.
Thank you.
You bet. Thank you. Next slide. Community, and I just indicated the community funding subaward process. The community funding subaward process has been designed to communicate key information to potential applicants to capture required information necessary to determine eligibility and then evaluate risk and ask questions that will be used to evaluate proposals against the evaluation rubric that we're proposing today. The next bullet, the community funding subaward process will also include information communicated to potential applicants about the board's priorities for the use of funds. And this is where we'll be talking in a few slides about the categories and the input from the Board of Supervisors on what those categories could be. We have categories that we presented a couple of weeks ago. As I said today, one of the modifications we're making on the categories is to add the category of behavioral and mental health along with other categories. And so when we get to that slide, you'll see that we're using examples of items or programs that could be within the category, but we're not defining what that category is, because I believe when we get into definitions, specific definitions, crafting definitions can take additional time, which may be a delay in the process. So we're using examples when we get to that slide on the categories. A couple of other bullets here. The direction is needed. To guide evaluators in making funding decisions. The discussion today will be focused on the board's priorities for funding categories and the project evaluation that's included there. Next slide. Okay, and so here's where we get into the categories of the funding area priorities. And you'll see up above, we've identified the funding available, the external funding amount at $5 million. And through the conversations from the last 5 months, what we've started to glean from those conversations are the categories that you see here below, identified as top priorities for the use of the Arpa funds for creating partnerships. So you'll see housing examples, and the examples are meant to be, can include, but are not limited to. And so this is where we get into, if we start to define and create definitions for each of these categories, we're bound to omit something out of just one of those things that sometimes we just don't always remember of all of the different things. So we put examples here and are recommended that we go with that category label. and examples of others. And so here, the next, support for vulnerable populations, and you see a number of different examples. We talked about veterans before, veterans, rural transportation, support for single head of households, childcare, elder programs, intimate partner violence, culturally based recovery programs, social safety net, FACS or other after-school programs, and workforce childcare. And so these are examples of supports to different populations in this particular category. The next, again, adding to the category list of mental behavioral health examples, and you see below, behavioral health, culturally based recovery programs, capital programs to extend treatment, et cetera. Again, other examples. Education examples, learning loss, social emotional learning, prevention education, student enrichment. Again, more examples here. And then COVID impacted small business support, examples, small business loans, grants, education, and support in the category of how we can address the needs of businesses that have been impacted by COVID. And then generally, COVID impact is another category. These are non-business COVID impacts. We've heard in terms of some of the local fire districts, but other programs, public programs, where their normal course of work has been greatly impacted because of COVID. And so we've listed this as a category. And then the final category here is workforce training, and examples that you see here, job training to unemployed or underemployed individuals. And so the questions for the board, Mr. Chair, first, of course, do these categories represent the priorities of the board? And then the next question, are there target allocations that the board would want to consider as we look at these areas and the available funding? And so again, the beginning of the discussion today, but certainly with the board's preference to go from here based on your direction. So Mr. Chair, back to you for this slide. Or did you want me to go to the very end and come back? You're muted, sir.
Now, each time it should be a percentage increase from a quarter now up to probably too much money to have to pay for my penalty. Let's see.
I may want to go to the end and then come back.
Okay.
Because I think as we get to some of the slides, they may inform your discussion on these slides. So let me walk through the end of the slide set.
And then I think it would be good that we come back through the outline. Okay, here's the regulatory piece. I think Lena had questions there and others might have them. I know Judy emphasized a big point about that. So, but if we do it by that way, that would be
okay.
good.
Okay, I'll walk through the next slides and then I'll come back to this one. Pre-evaluation rubric proposals would be screened for the following criteria. Responsive yes to all questions is required for the application to proceed to the partnership funding process or panel, depending on what is used for process. So I think some of these are basic questions. Is the application considered complete? Does the organization meet the eligibility criteria? And then is the project request, is it within an identified funding priority area? And then very key to this, and we've heard it throughout the process and throughout all discussions that the board has, the project area within Coconino County. And within that area, what is the geographic intersection of the proposed service to residents throughout the county? Next slide. Additional areas to look at, the project scope, going back to the location of services, that's going to be very important. Definitely needs to have a connection or a nexus with the COVID impact, and that's a Treasury guidance rule, is that whatever we're doing with the American Rescue Plan dollars, it must have a direct connection to the impacts of COVID. Also looking at population served, tracking, not only tracking the program, the service delivery, where within the county is that being provided, and then looking at outcomes and impacts that I believe we had heard before, in terms of making sure that whatever is being funded is impactful and we're making a difference with these dollars and this opportunity. And then looking at the design of the program, So examples of evaluation rubric. And then the discussion question here will be, are there additional categories in the area of evaluation that would lead to better or more effective evaluation and scoring? So again, is there something that's not on this list that you see here today? Next slide. But now these are additional considerations that the board may want to consider. Recipients, and in this case, we're referring to cities and towns and tribal nations, may not be direct recipients of state and local recovery funds that are received by Coconino County, funded through the American Rescue Plan, unless the request is to propose matching funds for collaboration with the recipient organization. And so, in other words, does a city or a town that is receiving or has received ARPA funds, would they be eligible to submit proposals? And what we have suggested here, we're not making a statement, but a consideration would be, is that if that funding or if that proposal was a partnership with the county who is also receiving the state and local recovery funds, that that proposal could be considered as it is a partnership proposal. And so that's a consideration to make here. Others proposals may be submitted for any amount with a minimum request of $25,000 and a maximum amount to be determined by the board. And so going back to the proposals that might be coming to the board, some may be by design smaller in investment and others larger in investment, knowing that the pool of funds available for all proposals is $5 million. Is there any thought with regard to the size of the proposal amount? I would say here that for organizations that may be smaller organizations and that may be submitting smaller grant awards, the application process is not challenging but formidable, meaning that the grantee would need to be registered as a sub-awardee with the federal government, receive a DUNS number. And so there are several steps in the grant making world that vying for federal funds does provide additional work in putting a grant proposal together with. The next bullet, total project funding will depend in part on funding amounts available. Therefore, proposal scaling is possible due to limited resources, meaning that if something is proposed and if the grant if the grant award is less than the amount that's been requested, is that proposal scalable? What would you be able to do if a grant award was funded at 50% or 25% or some other percent other than the 100% that's been requested? And then the discussion here, again, are there additional considerations or guidelines the board would like to include as part of the community funding process? So that's the takeaway question for this slide. Next slide. Community funding subaward selection and monitoring. And then going again back to the compliance. So the state, the recovery funds, short title, compliance and reporting guidance establishes compliance and reporting requirements for organizations receiving funds through the Act. And so that's a statement. And not only do the organization's direct expenditures and reporting need to comply with all the regulations laid out in guidance and of course in CFR, but all sub-recipient expenditures must also comply. And so in our case, we are the grant recipient, we are the fund recipient, and we need to then, as a result of other organizations receiving partnership funding, they too need to comply with the same requirements that we as the fund recipient are. And so that passes down based on the awards that we make. The next, compliance includes adherence to Part 200 of CFR, which covers federal grants and agreements, including general provisions, pre-award requirements, post-award requirements, cost principles, and audit requirements. So again, more compliance requirements as a result of the federal funds as the originating of those funds. And then finally, on this slide, each subpart has detailed guidance that must be followed by the recipient, in parentheses, pass-through entity, and their subrecipients, and it is the responsibility of the recipient to ensure sub-recipient compliance. So again, another way of saying that whatever process is used, if those funds are awarded to other organizations in carrying out the original proposal, they too would be responsible for the requirements of the funding that's passed to us by the feds. In slide 10, excuse me, the community's funding subaward selection and monitoring. Again, CFR establishes that in making subawards of ARPA funds, Coconino County creates an additional administrative burden to select entities that comply with federal requirements for subrecipients and evaluate the risk of awarding funds to each pass-through entity. So in our process of making awards, we are evaluating, I guess I want to kind of turn that around, the ability of organizations to carry out the reporting requirements, because if we do not have, if that ability and capacity is a better word for that, or for that subaward to actively report and do the work or the requirements, then we put the risk of the county as part of that, because of course, as the main recipient, we are held to the reporting requirements for compliance. And then the final bullet, the county is further required to design controls and monitoring processes that ensure that the subaward is used for authorized purposes in compliance with federal statutes, regulations, and the terms and conditions of the subaward, and that the subaward performance goals are achieved. So while this is a very serious, important information, I kind of feel like that the very tail end of those commercials, when you're having to read all of the fine print very, very quickly, this constitutes all of that. Very important, but the fine print that we are all held to as the recipient of the funds. Next slide. Options for methods of community funding selection and monitoring. And so we have two options. One being is it's a county internal process, is that the county staff, we administer the grant program. And so that's fairly stated as it is. It's an internal process. We manage it, we staff it, we ensure all of the pieces with regard to the grant program are carried out. The other option is to subcontract the through an RFP. We would go through a process of soliciting the opportunity in the communities, basically the nonprofit community broadly, for fund management through a third party. And so doing that, the county would develop the RFP, put together the guidelines that would include the outreach to potential partners, the application process, the evaluation process, the award process, and the reporting process. And so all of these pieces would be part of that RFP. In essence, we would be relying on the capacity of a third party to administer this program for us. Next slide. Considerations to take into account. Under compliance and risk, the issue of solicitation process, project evaluation, and the funding awards. And then the internal, if we do this internally, you can see the compliance risk is there, because that means that we're the ones that are doing it. So the staff time involved, capacity to develop the process, evaluate proposals, the award, create contracts, provides greater transparency, more control over funding decisions. All of those things happen because we are the ones that are administering that. Externally, leveraging awardees, existing frameworks for subaward solicitation and awarding. Other organizations do this. You know, this is their work. This is the business that they do, and so they have frameworks established and in place, ready to administer these types of grants. And so that's what would occur in the external area, and then also the lowered perception of conflict of interest concerns would be addressed, because this would be fully driven by funding priorities and rubric. And so it would be a kind of a third party administering that as opposed to the county administering a grant program that it itself is the fund recipient for. Under subrecipient monitoring, position vacancy, recruitment challenges. So we have attempted to, and we did our look, we've included in the ARPA funding budget positions to help us monitor and manage the administration of these funds. These are not easy positions to recruit for. And so we have had some position vacancies and some recruitment challenges to identify and to bring on board some of the staff that we would need to administer this internally. Again, the regulations are complex, and there are, since this is new, this is this is the first time probably in our professional lives that we've seen this type of a federal grant program going out. This is all new, and so we're establishing a lot of this for the first time. In the area of external, again, we would be leveraging and the organization by submitting a proposal to the county to be the third party provider. They would be basically utilizing their staff, and then we would also build into the RFP experience in managing federal funds as part of the consideration for that award to a subrecipient. Next slide. Recommendation. So my recommendation to the board in this particular program is that we do look at contracting this important work out to a third-party vendor. You can see here, part of the third-party scoring would include a county-wide outreach and communications, and getting back to some of the discussions and some of the concerns that have been laid out by the discussions we've had, is how do we ensure that every organization in the county or that serves the county is aware of the availability of these funds, so that we can ensure that this is there. That those awarded funds represent the broad county as large as we have. And then the next one, score of compliance, scope of compliance, and oversight is big. This is a big program, and as I went through all of the small print, if you will, all the things that we would be saying, as the closing of any commercial, there's a lot involved in this. And so given the work that we're doing and the fact that most of the departments, especially finance and HR and other areas, are really overburdened with a lot of things that we're doing on a day-to-day basis, to add this, speaking to Supervisor Fowler's observation, we're pretty much at capacity. And so relying on the third party, relying on the private nonprofit sector is a big consideration for this. Let's see, the county has the internal effort for compliance and monitoring. So even with all the work that we would be subcontracting out to a third party, we are still responsible for all of the other investments that may not be going through this process. And so all of the work that we've done with the county as the recipient for programs that the county administers, we're responsible for all the reporting of that. And so that is a fairly sizable responsibility. And then the final bullet here is to look down the pike. And so yesterday we had a meeting with our federal lobbyists to discuss the infrastructure bill. And so the infrastructure bill, which we're going to be coming to the board to present in the next few weeks, is yet another very much needed federal program that is going to entail additional federal funds coming to the county in various programs. And that is going to, of course, take up a lot of staff time in order to manage the grant recipient of responsibilities of receiving those. Again, they are, we need to have those in order to have the capacity to create the administrative and the compliance requirements that are needed. So again, all of these things rolled up go into my recommendation that we would be looking at administering the grant program that we just described through a procurement and through a third party process. And next slide, is there another slide? So we are to the discussion slide, Mr. Chair. We can go back to the compliance parts and kind of proceed through that so that the board has the opportunity to weigh in on some of the slide content and questions here. So if you want to go back, if we could go back to the first slide and kind of walk through. Let's see, program. Okay, the next slide. So this is the slide, I believe Supervisor Fowler had a question on the compliance slide here.
All right, let's go ahead and kind of work through, if we go back to the discussion overview, we have the regulatory environment, board direction, 1, 2, 3, we have it outlined. So if we go through each step, we can work our way through this and see where we end up. So going out to questions associated with the compliance. And Lena, you were starting to ask a question associated with this piece.
Actually, I'm going to wait on this one. So go ahead, because now that you're saying you just introduced a third party. So thank you. I
Okay.
was reading the third party and my mind's over there. We'll get back.
Okay, other board members on the regulatory piece. Scroll up and down. Okay, I'm not seeing anybody with questions on the regulatory component. Okay, let's walk into next area would be the funding area priorities, right? Board direction and funding area priorities. So again, outlined here, here are the different areas based on the conversations with the board. But really the question is, do these fit or are we missing some? We definitely need, are these the right areas of priority on this? And probably it might be good, let me just walk through each of the board members and see, and as we get into the conversation, if we do, there might be something that bubbles up so we can go back. Let's walk through it. Supervisor Horstman.
Yes, and thank you. And, I want to thank the county manager and the staff for the tremendous amount of time and effort and work and going back and back and back and back on this important discussion and providing us the information. I know this has been a very time-consuming process, for our staff, and I just want to indicate the importance to our community, and I certainly appreciate all the hard work and effort from our staff in getting this together. So that would be number one. I think this is really a wonderful opportunity for our community, this $5 million and community partnership. And I think it's consistent with what our, kind of putting our money where our values are. And I do believe that the funding area priorities as set do exactly that. I think there's some that may be a little duplication on what we've already done, if you will. But I think that's going to work itself out during the application process, or for those that are actually applying. And I'm going to give you some examples. First, I'll take it through housing. Absolutely, that is got to be one of the high priorities. I appreciate the level that many of our municipalities are giving housing in their ARPA funds. And I think that's absolutely needed for our community. I think Coconino County has definitely been, and their economic development has been hurt because of a lack of affordable housing, workforce housing, and then our most vulnerable population, the unhoused persons. Certainly, we need to make sure that we are taking care of our most vulnerable. And that gets right into the second, vulnerable populations. And so that's part of the overlap we're talking about. But certainly for vulnerable populations, that also could talk about elder programs. I think women programs, women-oriented programs, which were not specifically mentioned, but I think that they do fall into the vulnerable population category as well. Veterans, I think obviously that's very important. Intimate partner violence, we all know the difficulties and the need there as well. Cultural-based recovery programs, obviously all of this is excellent. And it may, again, overlap into housing, and it will overlap into mental and behavioral health treatment and support. And I think all of that's going to work itself out during the application and application review process. In terms of education, again, we've just given quite a large sum of money to our county school superintendent and that may be a little overlap. On the other hand, I also see that there may be additional needs outside the programming that the money we've just given our county school superintendent. So again, I think that will also kind of work itself out, if you will, in the application process. Impact small business support, I think that's important. I know that the city of Flagstaff, and I know other areas as well, have looked to try to provide low interest loans and grants for small businesses that were directly affected by COVID. You know, our mom and pop industries and businesses here throughout our whole county are an important part of what makes our communities vibrant and also part of our economic development. So I'm a big supporter of that as well. COVID impact, I'm not sure how that fits in, I gotta tell you, and because you're talking about non-businesses and you talk about fire station, local government partnerships, etc. But I guess you're saying here in Coconino County, we have, basically fire districts. And I guess what you're saying here is a fire district could make an application under this. And so again, that's just fine. I think that's important. And it will work itself out through the grant process. Workforce training, that also may also be part of small business support. But I think it's okay. And so what I'm saying is I do think that in general, there's overlap. That's okay. I think the overall question is have we, are our categories representative of the priorities of the board? Speaking for me, I believe they are, and I support the funding area priorities as submitted.
Okay. District 2, Geronimo, Supervisor Veskes.
Yes, thank you. Thank you for providing this layout, and I definitely am in support of these funding area priorities. Again, I think there's it looks like based on some of the suggestions that's where a rare methodology would be helpful to finalize which ones we want to prioritize in those buckets. Do these categories represent the priorities of the board? I believe so. I think we're covering the majority of what our community partnerships need to address. Again, that's why I keep going back to that rapid assessment and response evaluation. I don't want us to get bogged down, but I do want us to make sure that we're catching everything and we're not leaving any gaps. And then the question is talking about allocation or whatnot in terms of percentage or actually dollar amounts. I was kind of looking at it. I really like the recommendation of the board or of the staff for the board to allocate 2 million of the 5 towards mental health related services and treatment with community partners. I think we do need to make that investment. We do need to support those programs as long as we have the proper methodology to determine what those needs are. But if you look at that, that's 40% of the whole pie. And so as far as what the rest of the pie, I'm okay with allocating percentages or dollar amounts either way. But I do want it to be fair. So if we do choose a percentage or the numbers are a little bit different and it's not the same percentage for every single one, keep it within a range, like 5% of pick it, like divided by 7 or 6, I think it's 60, we got 60% to divide up by 7 if I count all the brackets right. So divide that number and do plus or minus like 5% to create that range. So that way we're not fixed on a fixed dollar amount, but we have a range of flexibility. So that way, some of those areas that might need a little bit more, we can provide those services, and some of them that might not need as much can let go of some of that. So it goes in the other bucket without leaving any of those topics without the funding that they need. So that's kind of where I'm at with it. I do support the funding area priorities. I do support the idea, and this is kind of going back, but I'll just kind of throw it out there. The idea of having a third party group manage the finances, because I don't want our in-house folks to get overwhelmed. I just want to make sure that we have the time to look and find that party who has the proper experience and can manage these federal dollars in the proper way, so that later on we don't have any problems with audits or whatnot. So I am in support of having a third party. I just want to make sure that we have the proper time to vet them and make sure that we have the right fit for the job. So thank you.
All right, Supervisor Begay.
Okay, I just want to thank the staff and the county manager and others that have really put this whole plan together. And I know it's a tedious job to really go into detail, all the way from developing tools all the way down to getting the excuse me, evaluations done, and then also to awarding and then compliance issues. All these things come into play. So I'm just sitting here thinking that, you know, I do support the 2 million of the dollars to be used for mental health. And one of the things I always keep saying is that, you know, we need to target the whole county of Coconino, people that voted in the Coconino County. And then also, as far as, you know, addressing and giving dollars to the superintendent of schools, the juvenile detention, the behavioral health, supporting that, and then also mental health port expansion and the CI. I think all of that is needed, you know, and we have to really look at prevention. We have to look at certain areas and aspects of the whole organization and functions, and also the duties and responsibilities. And so I'm just sitting here thinking, you know, this is a good opportunity. One of the things I really would like to ensure or try to push is possibly the sustainability in this. And I think that, you know, we really just start looking at things, how we may be able to sustain certain parts of it, of what we're developing or what we're helping out with. And so that will be a big key to this whole planning that's being put together by our staff. So I do support the dollar amounts that are being forwarded to us, and then also, you know, to go with an outside evaluation a company, because I think it's only going to add on to, I guess it's a third-party vendor I'm talking about, is to make sure that, you know, it's done that way, only because it's you know, we have to really be in compliance, and I'm really into making sure that, you know, we're spending the dollars the way we should be, and that all reporting requirements are done, and, you know, there's funding all the way down to the T as far as how much money has been spent and left and whatever. So and of course, monitoring is a big aspect of that whole process. So I just want to say that, and again, you know, other areas have been addressed by other that I want to speak to, but, you know, those are what Patrice and also Geronimo had mentioned. So I do support that. So I just want to say thank you to the staff. And then, you know, that they're the ones that already know what their priorities are within each of their departments in order to function, you know, as a county and department. So I trust that whatever, you know, they're presenting and asking for. Thank you.
All right, thank you. And then Vice Chair Fallon, Lena?
Oh, thank you. You know, I like to see what the proposals are. I like to find out who is applying. I like to have a list of who's applying. What I like to know is where do they provide the service? And how long have they provide that service out there? Or is this the first time they're proposing to provide a service in a certain area? I think each of these categories are very important. You know, we look at a family, you know, you gotta think about all of these from a kitchen table type. When the families are sitting together, if they have a place, and if an individual is sitting there, you know, what is it that they're having to deal with? That's what we're looking at. Housing, unhoused person, is the person, a veteran, and all these categories. And we are really looking into a person with their mental health, and we're saying behavioral health. And we are really touching a person, an individual, and then a family, and then a community, and then a region and the county. And how then are these applicants that we're talking about, where do they fall within that? And how is it that they're saying they are going to provide that service? And is it really the service that we're looking at or looking for? Or how is it that they know that that is needed out there? Yes, we're all talking about mental health. We probably all need mental health and behavioral treatment. Having gone through, you know, a lot of stress with what we have been dealing with, losing family members, and just friends and families, community members that we know that are not with us anymore. And so I like to find out if these programs that we're talking about, we don't know who's applying. I certainly don't know. I don't know what they're saying they're going to provide. I don't know the locations. I don't know the amount they're requesting. And I don't know how those programs are being proposed to intersect with our own programs that we have and the new programs that are coming in. And the education, you know, where are they with the schools and how are they interacting? Are they already there with the schools? Are they already helping students? And where is that help taking place? You know, that is really what I'm looking at. I know small businesses need help. You know, that it'd be very helpful to have, you know, business loan, and that is just really reinvesting in ourselves as a county. And education, you know, we lost population. We have lost population through the pandemic, shutdown of NGS and other small businesses, and the Black Mesa mine, the Kayenta mine shut down. We lost families. I mean, we didn't lose them, but yeah, population-wise, we did. And our education level has gone down, and when businesses want to move into our region, they look at the education level. And so then how do we recover economically? And that goes back to, people sitting at the kitchen table. Do they have a job? How are they doing? And, these are all things that we are looking at through this funding. And so is this the right fit for us? We don't know until we actually look at the proposals. And just trying to see, I think these are the priorities. Our priority is the wellness and the well-being and the health of our residents in our county. That's what we're looking at. That's the way I'm looking at it, and we'll see what comes in. And then we have $5 million that we're looking at. We just started a new division, or we're going to, with the mental health and the health department. I can't see why we can't just open up a program that will oversee all of the fundings within the county, within the finance. It's, we have in the finance a grant, someone that is overseeing all the outside funding that comes into the county. This to me is no different, and we could open up a program. We know what the regulations are. We know what the reporting is, and I don't think we need to outsource it. I think we can do internally rather than outsourcing it. So I rather look at that, but that's what I would see. So when we're being asked, how much the allocation, I certainly don't know, because I like to see what is being proposed, what aspect of education is being looked at. And then the evaluation, pre-evaluation, we don't know what the application packet looks like. I guess they have to have their finance, their balance sheets, everything all figured out. And that's how we'll be able to look at them, and that makes them eligible. We don't know what the eligibility criteria is, but it's probably outlined already. Yes, location of these programs are very important, but I think the other part is to see what the exit plan is. This is one-time funding, and how are they going to use that? And the service area, targeted population, same thing that we had our departments look at. That should be part of the what we should, I think, should be looking at. The sustainability. Are they planning to use this as a way to make their current programs more sustainable? Is that what they're looking at? We don't know that. And how is it that that's why I think exit plan is important. How are they partnering with us and other partners in the community? And then I think you have the data, and how are we going to know they're having the true impact on the community? Is there any matching funds? Are they going after other programs? And then we just talked about the cities, are they towns and others that have tribes? They also have getting their own federal dollars now. What's that partnership? Is there a partnership that's there? Are they receiving funds from those other agencies? I think those are maybe some things to look at. And then you ask if cities, towns and tribes, if they're maybe requesting funds that be maybe request oh yeah, I agree, matching funds. I think that's something that we usually do. So I think that's something that we need to look at.
So Lena,
uh,
so we were, I was hoping that, we could kind of walk through these different pieces. You're walking through the whole thing right now. And yeah, because a lot of the pieces that when you're talking about, when we're looking at the categories, I thought, there are areas that probably could be defined better in the evaluation rubric.
okay.
How do you make sure those people are getting to the services? The good thing is these are pieces that help with staff developing the rubric and enhancing it. What are we looking for associated with it? But I was hoping we could go back to, I got bits and pieces that captured later sections from a few of the supervisors. The first piece would be, the funding area priorities. Are we missing any? Does this capture it? They can't fully define each one, but it could be areas we're missing. And then, the next piece would be are we okay with the allocations of dollars, percentages? Do we want to comment on that? Geronimo discussed it a little bit. Judy touched on it, but we probably need to go back and check in with each of us on that. So in terms of the categories, where, are we missing anything there? So I'll swing back to Lena because the others already commented on those.
I think Patrice had her hand up. She can go first.
Okay, she covered the categories. Okay.
I did cover the categories, so
Okay.
if Supervisor Fowler wants to do that, that's great. I have another matter, so I think we should do the categories first.
Are we missing anything in the categories?
Well,
Go ahead.
I guess what we'll learn in the process is what does support vulnerable population mean? That could be a direct funding or help someone directly, but we don't know that yet. We don't know what the proposals are. So in general, I guess I agree with this.
Okay. And let me try and guide the conversation or work on that. I mean, generally, I see the categories are broad scope. So they're covering a lot of the service areas that I know we've had input on and we've discussed. I could see areas of vulnerability, or support that we need. Some of the discussions about supporting businesses have been in there. The COVID impact pieces, in response to, I think, your comments earlier, Patrice, some of the Arpa funding is the impact. A lot of it is associated with the impact of COVID and what happened. We had first responders that are out there that they don't have any allocation, and yet they did have impact as it relates to them. And so that's kind of how I see that particular category, depending upon what the applications are associated with it. It doesn't, it provides the venue for the opportunity for them to provide. We've heard some input of impact. Do they have an application, or maybe they don't on it, but having it in there as a category, I'm okay with. I see, the workforce training. I listened to some of your comments, Lena, in terms of what are we doing for the communities to make the communities better, the education component, the business component, they're built in there. But we also have the housing piece, the vulnerable populations. I think it does get to the, it depends. You could use the example of a single individual household, or and the vulnerability associated with that, or there are many areas that we see associated with our services where we have gaps, that there is an opportunity for it. So all in all, my own feeling associated with the categories are, maybe we're missing one, but we attempted to cover them. So I'm okay with that. And in terms of before we go to another category or area, let me go back to Patricia. You had your hand up on this. Yeah, go ahead.
Actually, Chair, you clarified it. Yeah, I thought we were just trying to deal with the funding area priorities, because I have comments to make on some of the other areas, but I thought we were going to go through those kind of in an orderly fashion. So I'll just wait on that. To answer your question on the 5 million, normally I would prefer just to see 5 million and just kind of see how the applications come out and what the how they are awarded. But we as a county are making a tremendous commitment internally to behavioral and mental health. And I have a feeling in order to really fulfill that tremendous commitment to the behavioral and mental health, that we should set aside a certain sum of money for the partnership, the outside community partnerships. So I would support the 2 million for mental and behavioral health treatment as part of our funding area priorities.
So on that particular area, I've heard from Hieronyma, heard from Judy. You want to come back to that, Hieronyma? Is that where you're waving your hand, or you want to come? Okay.
I
Yeah,
do.
okay.
I still stand that I support that. I did look at numbers and take into account if we went with an outside third party and how much that would cost to, if we did like 3% or whatnot for the overhead cost, and applied 2 million to mental health, that would leave us $4,850,000. And if you divided that by 7 ways there, that would make each bucket $475,000. And so thinking through math, and then we don't have to finite numbers, but when I was working with 21st Century funding with federal funds, we were allowed to change line items up to 10%. So if we were to choose some bucket parameters, but then know that we have the flexibility or build in the flexibility to move line items from bucket to bucket by 10%, then we could adjust that per se. So I don't know what the overhead costs would be to manage this, the grant, as we spoke to earlier, as a third party vendor, or I don't know if that would be paid for through other funding, and then it would be a full 5 million. I just did my math right now based on 3% of overhead costs, taking away $2 million, and then dividing that by the 7, and it actually should be 6. So the number would actually be higher because mental health is already taken care of. I just counted how many bullets, 2, 4, 6, 7. So it would actually be 6. So the number would be a little bit higher, but that was kind of the equation that I used to calculate that number. But I'm supportive of the 2 million aside, the third party managing it, and then dividing up the rest of the buckets evenly, but with 10% line item flexibility.
We have not even received the proposal for the mental health, and we're already committing $2 million to that. We are making commitments without even having seen a proposal.
Okay.
And how is that? This is, we have all of these others that we need to go through, and how can we make a commitment to $2 million? And who is proposing to take on the mental health and behavioral health?
Okay, so in this case, you're questioning the 2 million because we don't have proposals.
Don't have a proposal, and I like to see I think this is premature to start making commitments when we have not seen the proposals that have come in yet.
Okay. Hang on a second. I'm going to go to Patrice, and then was that Judy that was asking? Yeah. Okay, let me go to Patrice, then I'll go to Judy.
Yeah.
And then Geronimo, you had your hand up. Go ahead,
Yeah.
Patrice.
Yeah, thanks, Chair. And by the way, I don't think we should be getting into the weeds on this. Obviously, if we go to an outside, which I would support, it's going to depend on what that RFP looks like. It's going to depend on what those proposals look like, and so I don't want to do that. And I think that would be doing a disservice, and we could be arguing on this thing until, probably 24 hours from now. I don't think that's where we are. I think the question is, do we want to set $2 million aside? I do. On the other hand, I'm therefore, if we do have a 3% or 4% or 5% or whatever it might be for some outside agency to come in and do this, I think it comes equally. And by that, I mean, usually it's a percentage of a total dollar amount. And so I'm not excluding behavioral or mental health from that. I do like and so I don't want to get into the weeds on that. And I'm not in favor of saying, okay, well then that's equally divided amongst the other areas, because quite frankly, I think housing is awfully important. And it may in fact, depending on what comes in, it may in fact get more than, quote, its equal share of something called workforce training or COVID impact, which may be covered by other things that we are doing. So I don't want to get into the weeds on that. And I think your question was about the 2 mil. I answered it. I want to make that clear. I'm not supporting just equal for the other areas. I just don't think we need to go there. And the other is, I also want to make it clear, I'm not expecting, maybe I'm wrong, but I'm not expecting that these applications are coming to the Board of Supervisors, and the Board of Supervisors are going to go through each application and make a decision based on each application. I think that's inappropriate. I don't think that's our role as the supervisors. I think we're here to set policy and the direction, and I totally expect that our staff can follow that policy and that direction as they move forward with this whole partnership process. So I don't want to look at the applications and then make a decision, because quite frankly, the application and the reviews and the prioritizing and how those applications come forward to us for recommendations, that's not my decision. That's not the board's decision. And so I hope we can move this forward, or we may be here all night. And quite frankly, I can't be here all night. And your question I have answered, Chair, and that is, I would agree to putting 2 million. If there is something that comes out of it because of our agreements for an outside agency, it comes out of that 2 million as well as the remaining 3 million. Thank you.
All right. I'll try and swing it around. Some of these are follow-up potentials too on it. Let's go to Judy. Judy.
Oh, gosh. I guess I'm lost now. And we were presented a presentation by the administration that worked hard on this thing here. There were questions within the PowerPoint that was given to us. They wanted our input on these questions. Do these categories represent the priorities of the board? Meaning housing, mental health, education, all the stuff that's listed there. That's one. Two is, are there target allocations by dollar amount or the percentage the board would like to establish? So that's number two. Number three is basically, are there any additional evaluation categories that would lead to better or more effectively evaluate and score the proposals? The other one is, are there any additional considerations or guidelines the board would like to include as part of the community funding process? Those are the input I thought this meeting was all about.
Yeah.
We're talking about anything, everything way out there. And we have to answer these questions for administration so they can take the next step. And to me, I think some of us already went and elaborated on it, hoping that, this is some of the things that they would need. This is another step getting to where we really need to go. The end result is all the way to getting them people funded. And then the last is get the evaluation. So I'm sitting here thinking, what are we doing? What's going on here? We need to let the administration, they just ask these simple questions and we're just way out in the left ball field. And I think we need to refocus on those discussions and any other discussion, but proposals will be submitted. Monies where they will be there. And on top of that, we're not going to fund everyone. There may be proposals that are incomplete, not meeting the deadline. So all of those factors take into play. So and to have everyone have equal share, I don't think that's going to happen, because some programs are smaller than the other ones. So and their proposals are going to be some proposal will be the bigger, and some of them will be smaller, maybe some in the medium range. So I'm thinking maybe we should go back to these questions that the board, the administration is asking for, and then we can go ahead and let them run with it again, so that we can move on with this, and let them do their job. And like I said, I trust their work. I trust they've been in these positions. I haven't been in the health program as far as in the county, evaluation and soliciting proposals and stuff like that. So, let them do their job. And, these are the things that they want help and or our views. It's good that they're involving us along the process, and we just need to move forward with them, for them. So that I'm just sitting here thinking about that. And yes, I do these the discussion on I think we did, the area of priorities is something that I personally think that is a good listing. And then are there target applications? I just went over it, saying that some proposal will be asking for a smaller amount than and there's going to be some that are going to be medium and some that's going to be higher. The 2 million, it may not even be 2 million. If we don't get that many proposals, then we can reallocate those to the others. So that's what I'm looking there. Are there any additional evaluation categories? The staff have always been doing evaluation rubrics, whether it be a developmental evaluation or or just a checklist or whatever. There's all sorts of evaluations out there. So I just wanted to say, let that I feel is something that I think they're already taken care of, and I trust them. And then the other one is the additional consideration guidelines were to include as part of the community funding process. And there's additional considerations already on there, and we went through over that. And if there's anybody else that wants to add on to this, we certainly can. So that's what I wanted to bring up. And then is there another one after that? I think that's about it. So let's help the staff and give them the tool or the answers to the questions they gave us, and let them move forward with it. They will certainly come back, and do that presentation again. Thank you.
All right, thank you, Judy. And actually, that is kind of where I was trying to go. Let's walk through this systematically on each one of these, and we were on we went through regulatory board direction, was looking at categories. We've solved the category question. What I've heard so far on the discussion associated with, are there target allocations by dollar percentage for the board would like to establish? I've heard 3, Geronimo, Patrice, and Judy say the 2 million is good as recommended by staff on the behavioral health component related to mental health that was being a recommendation. And that could always, as noted, it could be a category that if not used, it could, let's revisit later on. Geronimo, you wanted to comment?
Yes, so I'm in agreement with my colleagues. I agree that the 2 million needs to be set aside. That if we use a third party, the percentage comes out of the full 5 million so that everybody's being, it's being used by the full amount rather than piecemealed. And as far as the percentages, I'm okay with us leaving it open as long as we have that evaluation methodology that I talked about earlier as part of that process to determine those programs, so that when we have the rubric, we've gone through that methodology. So I'm okay with that not having any percentages. What my concern is, by not allocating at least minimums for every group, we have the possibility of one of these areas not being addressed. And so I don't need max percentages, but I would like at least a minimum of, percentage for each of these topics so that we at least address some of those projects. So, and I'm not really too concerned about the percentage per each category. That's, like I said, that's not what concerns me. I just want to make sure that we're allocating projects for each of those buckets so that some don't get more emphasis and then other things on these other buckets get left out. I want to make sure that we're allocating funding to every bucket in some form or fashion. So that's all. Like the fixed number, I'm flexible on that. I don't have an issue with that. I just want to make sure that some of the other buckets don't take priority over certain areas. And at the end of the day, when all the money has been allocated out, we look back and we say, oh, we didn't really fund projects around social emotional learning and there's no money left. I want to make sure that these projects that have been identified by staff that are in need in each of these buckets get some funding. What that is, the percentage, I'm flexible about. I just want to make sure that everything that the staff has presented to us as funding priorities gets addressed. Thank you.
Okay. And so I've heard, let's see, on that, Patrice is concerned about maybe it's not equal. In terms of Judy's suggestion is that it's a little bit early. Again, this is an opportunity that staff could come back with, formulaic approach, or do we do it, by block formula?
Right.
A block might be a higher percentage, it might be a formula component. So it is a possibility that staff could follow up associated with that. I think I heard Lena saying we don't even know what these programs are, so not ready to figure out the amount so far. Patrice?
Good.
Chair, just to make it clear, I thought the question had to do with the 2 million. I've answered that question. I disagree. I think, for example, there may be some of these priority areas that should have bigger priority than others. COVID impact, I quite frankly think we've dealt with that through government already, and the same with education. So those are two examples that may not be funded because there may not be applications, or they may not be good applications. And so what I think the 2 million, I want to make that commitment. As for the remaining balance of it, I am going to leave that up to, I hope, our wonderful community, who I believe that some of these important areas, I've already heard from the folks for housing. I've already heard from the folks on supporting vulnerable population. I've already heard from folks with regards to small business support. And I'm going to expect that those community partnerships are absolutely going to apply for that funding. And I am absolutely certain that they will follow the criteria that has been set. And I'm assuming that our wonderful staff, who I totally believe are professionals, are going to be able to follow our commitment in terms of the rubric that we are going to set for the evaluation and be able to recommend the awards. And so I don't want to get into that right now. I don't think that's what the discussion is. I think we have the discussion, as Judy eloquently stated, in the PowerPoints that have been presented to us. And that doesn't mean that as we move forward, we may make some suggestions, but I don't think that that's where we are right now. And I'm certainly not willing to do a breakdown right now. And I do think some of these priorities are probably much more important than others. And I think that's going to come through when we get the applications from the members of our community. Thanks.
All right. Okay, so I haven't weighed in on the 2 million. I'm there on the, maybe I did. I'm starting to lose track of it. But 2 million, similar idea. It's a recommendation that was coming down to fulfill the broader piece of mental health. In terms of doing a formulaic approach, I think it's a little bit premature. Give the process staff time to go out and develop the process further associated with it. And bring it back. So that would be my input on it. Let's see, I think we pretty much covered, in terms of that financing piece.
Chair?
Yeah, go ahead, Lena. Go ahead, Lena.
Okay, there are two different things here.
Mhm.
The evaluators of these proposals. Now, I want to understand that Steve, our county manager, that is being done internally.
Well, that's,
And then
We-
there's.
We have to come to that question. Yeah, we haven't come to that one.
No, we have already had, it is if you go back, you have that presentation that, the evaluators, to guide the evaluators right here to make a decision.
Mhm.
So the evaluators is the page 4. So we're beyond that. And I want to know, who are the evaluators? Is that the evaluators and the outside agency that you're all talking about? Are they one and the same? And it's that this decision is not being made internally. It is the board that is looking to see what kind of priorities there are. So who are the evaluators?
So go ahead, Steve.
Supervisor Fowler, the evaluators in the third party option would be that the third party would be providing the evaluation based on the rubric and the evaluation ranking process that we spell out for them to basically propose to. So the evaluation of the proposals would come through the third party.
Yeah, I'm not very in favor of that. The rural communities are,
Okay.
I'm concerned about that.
Thank you.
I know you all want to move on, and you've already committed $2 million to the mental health. And there are other parts of this that is very important. There should be a revolving loan funds with $1 million just to the businesses, and we really need more than that. But I'm just concerned that how are the outside agency. I know we're getting to that, so I guess we'll get to it. I already covered this, and so I think I talked about this already, but I want to, since we're going by section, let's go to the next slide.
Yes. So in terms of the funding pieces,
And in
2
terms
million.
of these questions that are being asked, we can have our own questions. We are the Board of Supervisors. We're the ones that are guiding the staff. So if we have more questions that should be asked, these are just their evaluation. It is our opportunity to be able to ask these questions. So this is our time, and we have to make sure that all of our questions are answered, and that this is the way that we would like to see it rolled out.
Thank you.
So if we go back to the outline, we just went over the funding area and target allocations. Evaluation rubric would be the next piece associated with that. And Steve, you already outlined them, but you have them up there. And this is kind of where you were going, Lena. You already gave input associated with these, which Steve took down. Are there areas that we've missed in terms of what we need in the rubric here for an evaluation tool?
How are they gonna know that these, where they are proposing a project? How are they gonna know that that is what's needed there?
So Steve,
And
applications.
so that goes back to the methodology again.
Yes. And Mr. Chair, I'm gathering input right now. I don't have an answer for every question right now. So the question that you're proposing, all of the staff is writing down all of your observations and your concerns. But it does go back to Supervisor Vasquez's observation about the assessment part. And so looking at the assessment as a county-wide assessment, identifying what is the need, and then how are we aligning the resources to those needs is certainly something we would be following up on.
Yes.
And that, and that comes back to, in this particular category, it's an area that you can come back. Is there an assessment mechanism that's added in here? Okay.
Also, Mr. Chair, as an evaluation, as a proposal question can also be added that if a proposal, whatever the service is being proposed, what is the information or data that shows that the need for that particular service is in fact needed for that location within the county? And so there's two ways to do it, whether we do the county-wide assessment, which will take time, or when we look at the proposer and asking them to please provide the information that, the needs have been assessed and that there's data that's been shown to show that, in fact, in this particular community, there is a need for this particular service. So there's a couple of ways to address that.
Supervisor Vasquez.
Yes, thank you. The one piece on this list that I don't see, and maybe it's embedded in one of them and I'm just missing it, is the literature review of what's the problem is, what's the best practices, like have they gone in and done that research? That's the first step in RARE, is you go in and see all the different articles and research that's been done around this specific issue and compile that as you're going through with your first evaluation. And like I said, maybe that's embedded in there, but I just want to make sure that we're looking at that as we're going through. So we know that we have the literature review completed and we have the best practices identified for those issues once we know what they are.
Thanks.
Thank you.
Supervisor Bushman.
Yeah, thank you. The evaluation rubric, I think, looks good. A couple just minor tweaks I'd recommend under location of services. So I'd also take a look at service population area. Sometimes you might be in a certain area, but you're actually serving a much broader population. So I would just kind of add that to that because I think that's important. And when you talk about tracking, I'm assuming you're talking about just periodic assessments or reporting back, as I assume what that is. I like that, and I think we should have periodic reports back. Quite frankly, I don't want to spend all of our time in the Board of Supervisors looking at these reports. We have a $2 million budget we're supposed to be overseeing, but I think it would be good on occasion for us to get reporting back to the board on these community partnerships. And if that's what's in there, Steve, I'm happy with that. Outcome impact, I think that's what you're talking about, need impact reports. I like that. And design, fine, I like that. One thing to add is a money match. And the next page, and I don't want to go ahead other than to say that money match, unless the request to propose matching fund for collaboration with the recipient organization. I like that. I also would like to see money match between nonprofits. I mean, if we find out that our dollar has a $2 return to us, then I want to see that. So I'd like to see that as part of the evaluation rubric if we can.
All right. In terms of others, let's see, Judy, in terms of evaluation rubric, are you okay with what we have? Do you have any more to add to it?
I'm just kind of thinking, the closeout report is in compliance with, well, I guess it's just compliance, and this all leads to that. So I'm not sure if compliance evaluation, I don't know, I think that might be under tracking too, so Steve, is that under tracking? Like at the end, they have to make sure that they're compliant with the funding requirements, and I know that people that do evaluations, they're experts in the areas of doing evaluation, that's all they do, and so you just give them a list of requirements or things that you want them have them do, and they're right on it, and they already know what to do and how to design it and how to ensure that there's compliance in getting the outcomes documented. So that's the only other area that I'm not sure if it's in tracking.
Right. Mr. Chair, members of the board, the Treasury requires periodic, if not, I believe monthly, maybe even monthly, tracking of activities that are funded. And so also part of that, when we get to that point down the road, we'll need to provide that as closeout reports as well. So there's a ample amount of reporting that's required with this.
That's
Yeah,
that's all I can see. Other than that, I think I see a lot of stuff that's usually used in an evaluation criteria.
Okay, roll through. Lena, do you see any other areas in the rubric? You've covered some of them in your earlier comments.
I covered most of what I thought, and it was repeated again by others as well. So.
Okay. On that, and I'm tracking. I think the the additional comments on the rubric. Just adding my 2 cents on it. They make sense associated with it. We do, Patrice hopped over there just double checking with others in terms of the 2B, the additional considerations. When we have the cities and towns, Patrice was suggesting a money match when you hopped over to that. One piece that, I'll throw my 2 cents in early on this particular one, because it sort of goes back to the rubric a little bit, is the not looking to repeat a program. Like, if the agency covers that program, let's not recreate a program. Let's get rid of redundancies, unless there's an opportunity that, say, we're serving a vulnerable population, that it fits. That agency may not have that element associated with it. So that was a piece, as I looked at it, and I like the idea of attempting to match associated with that as much as possible. Let's swing through. Patrice, you hit on it, but did you cover your 2B on your earlier comments?
Absolutely, I did.
Okay, which is this additional considerations. Veronima?
Sorry. I'm good. I think I agree with the suggestions from my colleagues, and I think the evaluation rubric is where it needs to be. So I'm okay with where we're at. Thank you.
Okay. Judy?
The only thing I'm gonna say is if the staff feel, or the manager, Steve, finds anything along the way that they can use, they can go ahead and add that on, just to ensure that we are in compliance with the fundings and stuff like that, and to like their reporting requirements. So that's the only thing I would like to say.
Okay. Lena?
We're still on evaluation.
Additional considerations, the recipients, cities and towns, proposals, how they're submitted.
I already covered that.
Oh, okay.
Can we advance the slide to wherever we're at, whoever's doing this? Thanks.
I already covered that, and that's when you guys
Right,
stopped
thanks.
me, because everybody else were talking about it too.
Okay. Okay, with that covered, it swings back to the question. Page 11, options for methods of community funding, selecting and monitoring. And there is the proposal of outside agency versus doing it internally. And so I know we heard others comment on it, but let's go over that, you know, as we're doing this sequential component. Patrice, your comments.
Thanks, and I think this is really important. You know, I definitely believe that we should do RFP for solicitation for fund management through third-party vendors. You know, as we know, our staff has been so overworked and continue to be overworked. And there are many position openings. We have so many vacancies going on right now. What we are looking at here is really specialized. And some of us have worked with organizations like United Way and ACF, where that is their specialty. And these individuals not only have special bonding requirements, they have special staff, both accountants, lawyers, you name it, because this is really a specialized area. And for us as a county, who are already have staff that are overworked and understaffed, to take on something like this. This is a $5 million program. I really think that the best use and to ensure that the money is well spent would be to utilize one of these organizations that are out there that absolutely specialize in this. I know that many other municipalities are utilizing these outside agencies to assist them with their Arpa money and not our Arpa money and partner and community partnership programs. And I really like that idea. I think it also helps for transparency to ensure equity and equality in the process. So there's not a thumb, if you will, weighing down a specific item on the process. It's going to be somebody from the outside that will do it fairly, and that there won't be any undue influence. I think it's the best way for us to let our community know that we are fair and that we're serious and that we want our money to be our money, which is our community money, to go out and have the best use we can for our community based on the criteria we, the board, have established and based on an application process that we, the board, have established and have approved. So we still have the, if you will, the decision making and set the priorities on how the money is to be distributed, and we are directing that to this third party. So I know that it costs money, and I know that Supervisor Vasquez has definitely noted that already, but it costs money internally too, you know, for our staff and the use of our staff. And so I do think it's money well spent to have an expert outside agency overseeing this. And I thank you, Steve, for presenting that as an option to the board. I highly recommend the recommendation made by the county manager.
Great. Supervisor Vasquez.
I just wanted to say in support of a third party, I having looked at how just internally all our staff is overworked. We don't want to add another thing to the plate that's going to be too much. I think we do need to take our time to figure out who that person is and vet them properly. Obviously not drag it out forever, but do our due diligence to see who we pick for that RFP. But I'm definitely in favor of a third party vendor so that we don't overtax our financial department here in the county and internal staff, but get extra help. Thank you.
All right. And Lena, you had expressed desire for internal, but we're hearing external at this point. Did you want to add any more comments, Lena?
So, you know, I still cannot understand why we cannot have our own. I believe that this is an internal, it is ours. We can take the same amount of dollars and use those dollars to hire internally. We can be just as accountable and transparent with all the other funds that we have. This is our decision. And I have to wonder if there is an organization out there that can actually look at the whole county. There isn't an organization that looks at the whole county. I'm hearing that there'll be no bias, no, you know, and this will be a fair, transparent process. I have to really look around to see if there's such an organization. Is there such an organization? Are we looking at just nonprofits? Are we looking at maybe a business to do this? What kind of organization are we looking at that we're thinking we're going to solicit RFP from?
Okay.
Are we, that's the question.
Okay.
Are we only looking at nonprofits? Are we looking at businesses that might manage this as well?
Well, they're both.
Or is it open to anybody?
Yeah, actually, go ahead, Steve.
Well, Mr. Chair, Vice Chair, there are both. There are both nonprofits that manage grant programs of different sizes, and also the private sector. As a result of the funding that's happened nationwide, you know, these types of enterprises are approaching us all the time. Now, I'm not saying, will that be are we going to contract? You know, that's going to depend on the proposal. You know, that's going to be the part of the RFP to see what is out there in terms of what are the resources out there that could possibly be serve this role. You know, and we also need to be prepared with the fact that if we get no proposals based on the RFP that's been drafted, then it is not a choice. Then we will be providing that service internally. And so again, it depends on how that proposal is drafted and what the capacity of the nonprofit sector and the private sector may be in proposing a solution to us.
Well,
All right.
thank you. And I just want to learn about that. And also, you know, right now that we're not talking about the current staff. Yes, our current staff are the ones that are stretched thin. This would be a whole just an office that oversees it with hired staff with all the resources that they need. We're not looking at the current staff. Currently, we have 63 or 62 job openings with Coconino County. That's with the new American Rescue Plan finance manager. So we have a finance manager that is taking care of the American Rescue Plan that we have just been going over internally. This is externally. We can create an office and create jobs in that office to manage this. I'm not thinking it's going to be the staff that exists right now. We can take those same dollars and create an office here.
And Mr. Chair, if I can comment on that, we do have a position in finance that was put together for this purpose. That position is actually turned over, and we're currently attempting to recruit it. We've not been successful. And then the other comment I want to make, we are also talking to other counties and other jurisdictions that are subcontracting this service out. Maricopa County, Yavapai County, City of Phoenix. And so we're looking at all the models, but this is one of the models that we're putting on the board's radar as we speak, because at some point, not at some point, and very soon, we need to start moving on getting these dollars programmed and in service in the community. Thanks.
Okay, well, I just like you all to just consider the internal. I know that position is there, and it's we're providing our input, and that would be my concern about external organization is that I have to wonder if there's an organization out there that can see beyond the peaks and that can see that all throughout the whole county, like we keep saying, and how the evaluations are going to be handled, and if that's really going to be looked at from a community perspective. And who's going to be on that evaluation team? That's the other thing, you know. So those are just my thoughts when it comes to looking at outside agencies.
Okay. So I'm going to bring it back, for wrap. Just my comments on this.
I have a comment.
I missed. I missed you. Did I miss you, Judy? I'm sorry.
It's me.
Oh, I'm yes, I do. I miss you, Judy.
I sit back and I listen.
I'm sorry.
I love to listen and then think about things in all angles. Okay, so the third, I did give my my thoughts on the third party, and I think a lot of organizations, they do third party, and we do want this to be fair and transparent. We want it to be successful. And I think going to third party would be probably the best thing, because if you're going to start hiring, you have to do the PDQs, position description, and then you have to do application process. You have to screen those applications. You gotta do background checks. Then you gotta, there's so many things that need to happen in that process. And these people that are in third parties are the ones that are already equipped to do these things. And yes, a lot of people, a lot of organizations use them. And I'm pretty sure other counties use them, just like Steve is saying. So we have to, and even the evaluation processes too. The board, I always say the board is a component there. Yes, we're like policy making people, and then making sure that, but the staff is there really to do the work, and to really look out and things, and they see the whole organization as a whole, and that they know what is needed and what they can get rid of or what they need to implement and things like that. So micromanagement is, shouldn't be anything. Not that I'm saying that anybody is, but I think that's not our job, is to micromanage the staff. And I think that, we just need to move on with this project, and we have to look at getting the money spent right away, because we could be talking next year the same thing again, because we still don't have people in place to get, to do the evaluations. So that's the last comment I was going to make, because that's the one that we're talking about right now.
All right, thank you, Judy. Okay, sorry I missed you there. I'm losing track of how to count. District 1, 2, 3, 4. So actually, just to bring in my comments on this, as I sit and look at it in terms of our own staff capacity, and you look at our past year, what we've been through, how we're trying to moderate our pace, and oh my gosh, try as we may, we have these additional outside influences coming in. We're timing, and even if we, we're working through this first phase of Arpa, which is taking a lot of staff time. Even if we had a third party, there is still a lot of staff involvement that comes in for indirect or direct relationship to what we're doing. And then we haven't even gotten to the infrastructure piece that's moving forward. And we're trying to sum up the congressional and state redistricting, only to step into our own redistricting. And so as you start to look at all these things and the pace that we're trying to moderate, we still have a lack of, and we're in the middle of the pandemic, the one that everything that's going on with COVID. I think we really have a challenge with staff capacity, what we have the capability of doing. I hope we can get the appropriate expertise, that we can put it out to a third party. I'm glad the points were made associated with there is money that will come, that we will have to put towards this, which is a very important piece. And if we don't, because the whole world might be going out there for bid, if we don't get a contract, it may come back to a lot of points that were just made of what we need to consider from an internal perspective. But I do support it. I think that helps us, kind of swing around to, it gives enough for staff to work on as we've walked through these different pieces of, they're shaping it. We're stepping into the holidays. People they need a break right now. It gives time for staff to go out with the information that we've just gathered, come back again to us, as we step back into it, take a look at it, and carry on the other pieces of the conversation that we haven't vetted or it's not shaped yet for. So I think we've really kind of walked our way through that. Steve, follow up on where we are.
Mr. Chair, members of the board, we received a lot of follow-ups, and I've had staff taking notes about all your observations. We want to, as the chair indicated, going into the holiday season, and the board's next meeting is on January 11th. We would like to come back at that time and give a status update on moving on executing some of the direction that you've provided today, which would include, again, there are so many follow-ups to identify or to go through with staff between now and then, and come back and say, what we heard you say is this, and this is what we're doing with regard to that. And so that's the process we're going to be using. But coming back to the board on January 11th with the status update and next steps as we are proposing to the board on this particular component. With regard to mental health, we're going to move on that with the discussions and some of the closing comments that you've identified. But so the other areas that are in progress is the grants to outside agencies. Also included in that are the categories. And then the category I want to also call out is the business supports. I do think we do need to have additional research done in that area. And so you'll probably be seeing a follow-up meeting on that, probably not until the January 11th date as well. So, but that's an important area as well. So those are my thoughts, sir.
Well, I'm seeing a lot of expression of concern to try and do this correctly, and everybody coming from a different angle, but really trying to do the right thing for the community. It's a lot of work for our staff, but we can incrementally approach this so that we get it shaped appropriately. And as Steve noted before, some pieces might have to be carried a little bit further, but we're getting closer and closer on this.
Yeah.
All right. So with that, I think it's a Friday afternoon. We've pretty much beaten this one up. I want to thank everybody for hanging in there. It's been a very busy and energy using week that we've had here. Thank you. I'll go ahead and adjourn the meeting and look forward to our future discussions on this. Thank you, everybody.
Thank you all very
Bye,
much.
everyone. Thank you.
Bye.